Hi guys. So today I want to tell you my labor and delivery story with preeclampsia and gestational diabetes. So let's get right into it. Um, so I remember that day, that morning, I woke up and I have been having contractions like overnight. But it felt like the usual Braxton Hicks contractions, so I didn't pay mind to it. In the morning, when I woke up, I did my morning routine and everything, and they were still there. So what I did was lay down, drink some water, hydrate myself, to see if they were away. 1 hour and a half went by, and they were still there. So I decided, you know what, I'm gonna walk around and see if that helps speed things up, if it's actual labor. I walked around for about 30 minutes. They didn't pick up, but they were there, and they were probably every 5 to 7 minutes. So I called my OB office. She said she was gonna make a few phone calls, so she called me like 3 minutes after that, and she told me, I want you to go to the emergency room. They are gonna wait in there for you and wheel you up to labor and delivery. The plan is to give you magnesium to stop the contractions and then send you home. So I was like, okay, cool. Call my husband. He was near the area. I was like, okay, honey, we have to go in. They're gonna give me some magnesium to probably stop the contractions, and we're gonna go on from there. So within 30 minutes, we got ready and we were at the hospital. We came through the ER. They wheeled us into it was labor and delivery, but it was a part where they handle only high risk patients. So it was a big room. They put me in the bed. They did all the IV, they took my vitals and everything, the nurse. Then the doctor came in a little bit later. He was like, okay, so we're planning to give you magnesium, da da da. It will stop the contraction. It will have a funny taste in your mouth, all the fun stuff. And I was like, okay. So he was like, okay, let me listen to your vitals. So he starts listening, for they did my blood pressure first. Since I had preeclampsia, my blood pressure was sky high, even on medication. And then they gave me some more medication there, even though I already took the one for that day. They gave me 2 medications to see if it could calm down, because it was really high due to the preeclampsia. And then he listened to my lungs and everything, and then he went out of the room, right? Then he comes in and tells me, you have fluid in your lungs, we are gonna induce you. We were not ready to get induced. So my husband was like, what? Then he has to come back home and pick up all the baby stuff, and then all that. So he tells me I'm gonna get induced because my blood pressure wasn't coming down as much as they wanted it to, even with like 4 medications. Because at the time I was in my own medication, which was 2, and then they gave me 2 different ones over there, and my blood pressure was still high, and I had fluid in my lungs. So he said, change of plans, you're gonna be induced. We're gonna start with Pitocin tonight, and then tomorrow you're gonna be moved, to the actual labor and delivery, the room that you are gonna deliver the baby and all that. So that's what they did. I spent that night in the hospital with a little bit of Pitocin in the IV, and nothing much happened. Like, the contractions were still the same. I was still the same dilation and all that. So the next day came, they up my Pitocin. They put more drops they were making it come faster, you know, so the contraction could come faster. They took me, at that point, they took me already to the labor and delivery room. The contractions were coming more often, more painful, because I don't know if you ever been induced, but when you get induced with any type of medication, your contractions are like twice as strong as they normally will be. So they were coming in strong. So the doctor, I know it was, since it was another day, it was a different doctor. It was a lady. She was a sweetheart. She came and checked me in, and told me, you know, the plan for what we could do first, next, and blah blah blah. So she checked me. At that point, I was 4 centimeters dilated and 50 or 60% effaced. So she said, okay, we're gonna put we're gonna see how everything goes. I'll come back in a few and then check you again. So, you know, they don't check you as often as you think they would. They come every like hour, 2 hours, 3 hours. So she came. My contractions were strong. I have to breathe through them. So she came about 2 hours later, and then she checked me, and I was still the same. And then she said, okay, we can try the balloon. I don't know if you have ever seen those. It's like, it's very little. I thought it was bigger than that. It's the first time they used it on me. It was about this size. It had 2 heads, and they put one between your cervix, and then one outside, and they fill them up with liquid, water, or whatever it is, so your cervix can expand and hopefully dilate faster. When I tell you that was the most painful thing I experienced, it was so painful. I think I only could handle it for about an hour because it was way too much. I was bleeding. It was so painful. They checked me about an hour. Oh, I think I called them. I probably called them, and I was like, I cannot take this anymore. Take it out. And so she was like, are you sure? It was this one was a different doctor because she was assisting on a labor at that moment. So another doctor came, and she was like, it was also a girl, and she was like, are you sure this could really, you know, help you? It hasn't been there that long. And I was like, yes. It's hurting way too much, on top of like the pitocin being like giving me really strong contractions. That medicine, that balloon in there was making everything even worse. So she took it out. It took a while to take it out. She checks me, and guess what? I was still the same. I was still 4. No, actually, I moved to a 5 centimeters dilated, and I was like 70% effaced. Yeah. So it did a little something, but not as much as I thought it would. With all the pain and the contractions that I was feeling with that thing in it, I thought it was gonna be way more than that. But I was like disappointed. But I was like, you know what? Let my body do his thing. I was trying to relax as much as possible, and all that. What happened after that? Let me see. A few hours went by, and my previous doctor came in. She checks me, and then I'm still at 5 centimeters and 80. I was 80% effaced. And she was like, I'm sorry, you know, you should really get the epidural. That should probably, you know, relax your body and let your body do what it needs to do. I really didn't want to get the epidural, since with my last pregnancy, I had a really bad experience with the anesthesiologist. So I didn't want to get it at all. So I let a few hours go by. I was literally in the hospital. Like, if you counting the hours, even though I'm not saying hours, it was like probably like 3 days in the hospital. So yeah. A few hours went by, probably like 2 or 3. She comes back and checks me, and you know, every time she will come back and check me, I will have this hope of like my body doing something, because my body was contracting and my body was, you know, in pain, and I was exhausted. And I had this hope of like, yeah, maybe this time will be the time to push, or maybe this time will be, you know, far ahead. And then she comes and checks me, and it was disappointing because once again I was 5 centimeters still, and I was 80% effaced. I didn't move anything in those like 3 hours. So it was very discouraging and stressful, and I was crying, and I was like, you know what, let's get the epidural. Let's get the epidural because I need to sleep. I haven't slept in like 2 days, almost 3 days. I'm exhausted. My body's exhausted. My mind is exhausted. So I was scared. The nurse there, she was awesome. She was amazing. We need more nurses like her, for real. So she, you know, they called the anesthesiologist, whatever. It was a girl, thankfully, this time. And she was, you know, she was like, I'm gonna do my best, don't worry, everything will be okay. The doctor holds my hand, the nurse holds my hand, and I'm crying because first of all, I didn't want to get it, and second of all, I had the experience with other anesthesiologists, so I didn't want to go through it again. So they holding my hands, and I'm squeezing them hard, and the doctor is doing, you know, his thing in the back, the anesthesiologist, and she puts the epidural. Everything went fine. And she leaves, you know, she does everything she needs to do back then, and then she leaves, and then I'm like, shouldn't it kicked in by now? And the nurse is like, yeah. I'm like, I can feel everything. She was like, are you sure? You know how they looked at you like, are you sure you're not that tired that, you know, your mind is playing tricks on you? I was like, yes, I'm sure I could lift up both of my legs up, literally. So she was like, okay, you're not supposed to be able to do that. Let me call her. So she came and she asked me the same question. She was like, are you sure? I was like, yes. So I did the same thing again. Like, I lifted my legs, moved them around, wiggled them. And I was like, yeah, I didn't work at all. I can feel everything. So she comes and puts more in there. This time, one of my legs goes up. It feels warm and tingly, but I can still move it around and all that. And she was like, I'm sorry, that's, you know, the limit. There is nothing else we can do. I was like, it's fine. So it did to that second time she put something, it did to the edge a little bit of it, but it was still there. And then, well, in the hopes of it helping a little bit, at least, you know, relax the muscle or something, we waited like about 2 more hours. It was like almost 2 to 3 hours that they come and check me. She comes and check me. And once again, I have my hopes very high, thinking, you know, maybe he did something this time. And I was still 5 centimeters and 80% effaced. So I started crying. My husband, you know, trying to calm me down. It was so stressful. And the baby kept moving. She kept moving, and they couldn't find her heart. So the nurse was literally living in the room with me, moving the monitor to listen to the baby's heart, even though she was fine. But, you know, they need to be able to monitor the baby's heart. So she kept moving. So the whole time I was there, she was there with me, finding the baby's heart. And then they were telling me that if they couldn't keep it in the monitor, they were gonna have to insert something internally and put something on the baby's head to make sure that they can keep a steady heartbeat, and they can, you know, see how she was doing. At this point, it's been 3 days that I have been there awake, not able to sleep. I am exhausted. I am frustrated. I am mad. I am sad. I'm everything in the book. And then they didn't talk to me about C-section, and I did not want it a C-section. They already knew that beforehand, like since my OB office, you know. But if it was something that we would have to get, I was considering it. I was so tired at that point. So she comes and checks me this last time, and I'm crying, I'm frustrated, I'm exhausted, I'm everything, and she checks me, and I'm like praying that this time will be the time. And then she looks at me with this sad face because she knows like I'm going through it. So she looks at me and she's like, I'm sorry, you're still out of 5. I'm like, are you sure? She was like, yeah, you're still 5 and 80% effect. I started crying, bawling my eyes out. She was like, we have the vacuum. We can try and suck the baby out, from the head. I'll let you, she gave me a few options, and then she was like, I'll let you decide with your husband, da da da. I could barely hear any of the options. I was bawling my eyes out. I was exhausted. I wanted to be done. I wanted it to be done and over with. I wanted it here. I wanted the pain to be done. It was a lot. So, not even 2 minutes after she gets out of the room, at this point, I had another nurse. I think at the same time the doctor came, they gave me a younger nurse. The other one left. You know how it is. They change every certain hours. So she comes in. The doctor comes, checks me, and she was like, "I'm sorry, blah blah blah." So not even 2 minutes after she gets out of the room, I feel like I'm going to poop myself. And I'm like, I know, I have had kids before, so I know it's time to push. And I tell the nurse, I think the baby is coming. And she looks at me like, are you insane? She just checked you and you are 5 centimeters and 80% effaced. Like, not even a minute ago, like a few seconds ago. So she's like looking at me like, what? So I'm like, I need to push. This baby's coming. So she goes down and looks. And then she's like, oh crap, she gets out of the room, she gets the doctor, and everybody starts running and all that. It was time to go. How did that happen? I don't know. She just checked me. I went from 5 to 10 to 100 in like 30 seconds. And then next thing you know, not even 2-3 minutes, I would say like 3 minutes later, they had the room ready. I was pushing. It took 3 pushes to get her out because I needed her out. So I gathered all my strength. The first push, it was a hard one. I was like, keep telling myself, you can do this, you got this. This is like literally almost over. This is what you've been waiting for, so push. So I push, and then she tells me not to push because, they have to check for the baby umbilical cord, not to be wrapped up around the neck and all that to avoid injuries. And then second push, she's almost out. They trying to get the shoulders out. And then third push, she's up in the world and happy birthday, and she's out, and I'm exhausted and I'm happy and the pain is gone, literally. And yeah, it was a lot. It was a lot. But then they took her out, put her on my chest. My husband got the umbilical cord. She was with me for about 5 minutes before they took her out completely, because since I had gestational diabetes, she needs to be tested for her sugar levels as well. Even though she was fine the whole time, she didn't grow more, and she didn't have any of the risks that she could have had for me being gestational diabetes. They have to still check her sugar twice, every certain hours, I can remember, and they have to do a few tests on her. So they take her away, they get me ready, and they put me in the room that I was gonna stay for the next 2 days. Then they bring me the baby, all wrapped up and all cute and smelling good, and it it was so amazing. It was so amazing to like have her there. And she was tiny, but she wasn't as tiny as a preemie will be, but she wouldn't fit. She was 6 pounds. 6 pounds 2 ounces when she was born, and she was 19 inches. 19 inches? She was 6 pounds when she was born. And then but she was the tiniest thing. I have my first born was also 6 pounds, but she wasn't that little. I don't remember her being so little. And she wouldn't fit in the newborn clothes. Of course, we have to buy preemie, because, you know, technically she was a preemie, even though she weighed a normal size, like full-term baby weight. We have to get her a few preemie stuff because everything was huge on her. What else? So they were gonna let me go, not the day after, and we couldn't go because the baby had jaundice, and she hadn't pooped. She hadn't taken her first poop, and she needed to poop before they can let me go to know, you know, everything is working fine. She passed all her tests with flying colors, but she hadn't pooped. So they kept us there in an extra day just to make sure that she was okay. So she was being taken a lot from me to like test her sugar, test her jaundice. You know, every time she was with me in the room, they would tell me to put her near the window so she can get some sunlight for vitamin D. And but then she finally pooped a whole bunch for them. She was like, okay, you want poop, here you go. So she did. And then so they let us take her home. And so yeah, I think that's pretty much it. We came home, and then she was fine. She had a few appointments after that, and I had a few appointments after that, just to check that my blood pressure was normalized. And because you can still have preeclampsia even after delivery, and you can still die from it after delivery. So it's not something that they worry only about during pregnancy. They worried about after pregnancy too. After you deliver the baby, a few months after that, like, you can still have issues with it. So they kept monitoring me, and they kept monitoring the baby for the jaundice. She had a few appointments after that, and then I did too. But we are all good now. I don't have preeclampsia. I don't have high blood pressure. I don't have diabetes. I'm good. The baby's good. So yeah, it was quite an experience, and it was, you know, a hard one, but we made it through it. And yeah, we're here, and we're happy, and she's beautiful, and I'm happy. And yeah, so that's it for my labor and delivery story with preeclampsia and gestational diabetes. And if you guys have any questions, just put it down below, and then I can answer, you know, as many questions as I can. And if you want the story on how I got diagnosed with preeclampsia and gestational diabetes, I can also do a separate video. I'm new at all this recording, so it's kind of weird to me. But I can answer as many questions as I can. And yeah, I'll see you guys later. Bye.